So cardiology is one branch where you can see a person dying in front of your eyes and walk away home in the same evening totally fine. So hello everyone, I'm Dr. Shivam Arora and I've secured rank 9th in NEET PG 2020 exam, and then I've completed my MD medicine from Maulana Azad Medical College, and then I cleared my INISS exam, and then currently I'm doing my DM cardiology from AIMS New Delhi. So a lot of people ask me that why I am pursuing DM cardiology, because it's a very saturated branch according to some people, and it's a very old branch when a lot of new branches are coming up, which are highly recommended by some people because of the money involved in them. So first of all, I tell you why I chose cardiology, and then we'll discuss about the merits and demerits of this particular branch. So when I was preparing for my AIPMT exam in 11th and 12th class, I have a very keen interest in this mathematics and physiology, but I always wanted to become a doctor. So I gave the entrances of both the exams, IIT as well as NEET, cleared both, but I always wanted to become a doctor, so I chose this path. But then at the same time, I was missing the thrill of physics and mathematics during my first and second year of MBBS. But when I started reading medicine and per se cardiology and the ECG part per se, I started getting that thrill again, because cardiology is a very logical branch. It is all about the graphs, the pressures, the vectors, the physics things that I used to love. So one thing was that. Another thing was the satisfaction involved in this particular branch. You can treat a arrhythmia, and you can save a dying person. You can open a coronary artery of a person with MI, and you can get him out of the infarction phase and save his heart muscle. So basically, that is said that muscle time is muscle, and you can put a pacemaker to a person who is having complete heart block. So these all are the thrills that I used to love at that point of time. These were the reasons that I chose medicine and then cardiology. Now, discussing about the merits and demerits of this particular branch. So first of all, we'll discuss about the merits. So it's a branch which is a medicine branch, but it has interventions part too. So it will give you the thrill of surgery as well, and doing procedures and saving patients. And it's also a combination of radiology, because you will be doing your echo yourself, and you'll be doing transesophageal echo as well. So it's a combination of radiology, medicine, and surgical part. You'll be putting pacemakers, giving incisions, getting sutures done. So it's a combination of medicine, surgery, and radiology per se. And then it's a emergency branch also. So it's an amalgamation of emergency medicine too, because you will be doing emergency pericardiocentesis in a patient of cardiac tamponade, or you will be giving shocks to the patient who is having VT or VF. So, and you will be managing a patient of cardiac arrest, you will be managing a patient of STEMI by opening his coronary arteries or thrombolysis. So these all are the aspects that will give you the thrill, that will give you the satisfaction that no other branch can give. Apart from it, most people say that it is a very saturated branch, but it's a very growing branch. Within the last 1 or 2 decades, the advances in cardiology are enormous. Earlier we used to have 2D echo, now we have 3D echo. Earlier we used to replace the valve surgically, which is done by the CTVS people. Like we used to replace the mitral valve, tricuspid valve, aortic valve. Now the transcatheter replacement of these valves are coming up. Now we have 3D techniques to ablate the arrhythmia. So it's a very growing branch. So the scope is also increasing at a more rapid pace than the number of cardiologists are increasing. So all these aspects have to be taken into account. And again, it's an intervention branch, which is a plus point, because when you pass out from a non-intervention branch, you can earn more in the initial phase. One thing, like if you do DM endocrinology or DM medical oncology, or maybe MD radiology also, you will be earning more in the initial phase. You will just pass out, you will earn more, because you don't have a long learning curve. But again, in intervention branches, you will not earn more initially, but in the later phase, like after having 5 to 6 years of experience of coronary angiography, PCI, pacemakers, ablation, you will earn much more than these branches. Your earning will be unlimited, because the number of procedures you will be doing, all these have a cost. Like suppose a transcatheter aortic valve replacement now has a cost of 15 to 20 lakhs. A pacemaker, a CRT, has a cost of 6 to 8 lakhs. So These all are life-saving procedures at one part, and these have a cost. So if you will be experiencing these procedures, you will earn much more than the branches with no intervention. So all these are the perks of cardiology per se. The most important perk that I said earlier is the logicalness of this branch. This branch is very logical. You don't, and the results are very fast. You suppose a patient comes up with dementia or stroke. It will take some time, or maybe will never recover. You can just stop the progression. But in cardiology, most of the diseases shows great results when treated, like opening a coronary artery, putting a pacemaker, you know and putting a CRT. These things don't take much time, and the patient improves very fastly. Ablating a ventricular tachycardia, ablating a WPW syndrome. So these all are the perks that comes up with this branch. Now we're discussing about the demerits, which are less if you have a keen interest in this branch. So demerits will be more for people जो जिनको इंटरेस्ट नहीं है इस ब्रांच में, who are coming to this branch just for the glamourness, और उनको ऐसा लग रहा है कि social status is very big of a cardiologist. So चाहे अभी भी in your SS examination cardiology is not picked up early, but still it's a very glamorous branch, and the social status of a cardiologist is much more. इंडिया में जितने भी पद्म विभूषण मिले हैं टू अ डॉक्टर, कार्डियोलॉजिस्ट को सबसे ज़्यादा मिले. सो द सोशल स्टेटस इज मच मोर, बट अगेन यू कैंट कम अप टू दिस ब्रांच जस्ट फॉर द सोशल स्टेटस, बिकॉज इट हैज़ कम विद सम ऑफ द डिमेरिट्स. लाइक इट्स अ वेरी इमरजेंसी ब्रांच. अब अगर रात को 2 बजे भी आपके पास हार्ट अटैक का पेशेंट आएगा, यू हैव टू गो ओपन हिज कोरोनरी आर्टरी, एंड योर डोर टू यू नो your door to balloon time, that is the time you should be inflating his coronary artery, should be less than 90 minutes. You should wake up, go to the cath lab, open his coronary artery in 90 minutes. So it's such an emergency branch. It's not like you will receive a call at 2 a.m., you will go at 3 a.m., start doing the procedure at 4 a.m. It's not like that. You receive a call, you have to reach there in 20 minutes, you have to open his coronary artery within 90 minutes. So it's such an emergency branch, so you have to always be available on call. Another thing is the long working hours that it has come up with. So again, the training is hard, and although the with increasing awareness it is improving, but still it is hard. And again, another thing is the long learning curve. Any intervention branch, any surgical branch comes up with a learning curve. When I did my medicine, I can do the job after MD medicine. So it didn't have a long learning curve because I know most of the things. I don't have to learn any procedure now. So it will just be my experience. But with intervention or surgical branches, the drawbacks are that it will come up with a learning curve. Currently, I did some of PCI, some of pacemakers, but still I need a particular number to gain that confidence that I'll be able to do these procedures independently. So even after doing my DM cardiology, I need 2-3 years to gain experience, to smoothen my hand or something, to you know this curve of learning in the intervention branch is something that will delay your earning, and that will delay your independence. But again, this cost will be recovered in the coming years after gaining experience. So these are the perks and demerits of cardiology. But again, if you have interest in it, don't think that you should not do cardiology because it's a saturated branch, because it is having extreme stress or maybe long working hours. Because if you have interest in it, you will definitely be doing great in this particular branch. Another drawback that some people say is there is a radiation exposure, but with adequate gears and proper protection, you are good to go for the branch. So all the really best for your NEET PG counseling, NEET PG preparation, and future journey.